Hi there, Dr. Olivia of Dr. Olivia Naturals here. So I wanted to answer a question that I actually get quite often. And that question is if I have a hormonal imbalance, how can I lose weight? And I wish there was an easy answer to that question, but there's no one size fits all because there's so many different hormones. So the best answer I can give you is you identify that hormonal imbalance so you now know how to approach correcting that hormonal imbalance, which is going to improve your body's ability to make muscle, burn fat, deal with stress, sleep, because if you're not sleeping, you're not going to lose weight because your cells need to rest, regenerate, and recover. And if you're not sleeping because you're making too much cortisol at night, you're going to store fat in your belly. But if you're overproducing cortisol, you're going to burn out other hormones like DHEA, which you need to make estrogen and testosterone, and pregnenolone, which you need to make progesterone. So perimenopause or menopause does not affect your metabolism because estrogen is not responsible for weight loss. Testosterone is much more responsible for making muscle, burning fat, controlling your metabolism. So are your thyroid hormones. If you have elevated thyroid antibodies attacking your thyroid, you're going to have thyroid symptoms even if your TSH is normal. Your fat-burning thyroid hormone is T3. So if you have a low T3, a low free T3, your body's lacking a pretty important thyroid hormone that's responsible for burning fat as well as controlling your body temperature and your metabolism. So you have to know what hormonal imbalance you're dealing with. Are the cortisol levels low, high, or some combination of both? What are your DHEA levels? Because you need DHEA to make estrogen and testosterone is a major fat-burning hormone that your muscles need, your brain needs, your joints also need. We look at pregnenolone, progesterone. We look at sleep hormones like melatonin, cortisol, serotonin, and dopamine. So I wish there was a one-size-fits-all approach, but there's not. If you have a hormonal imbalance that's keeping you from losing weight, no matter how much you exercise or cut your calories, you're not going to see results. You have to know what's going on with your hormone system so your hormone system can work for you instead of against you and make you a fat-burning machine. You have to make sure your body's properly detoxifying estrogen because estrogen gets trapped in fat and glandular tissue. And it doesn't just make it hard for you to lose weight, it also increases your risk for a hormone-positive cancer. So there's not a quick answer. You really need to properly evaluate your health, your hormone health, your inflammation, your estrogen detox pathways in order to properly approach this. My advice to you is sleep well. Use things like magnesium to help shut down cortisol production at night so you can fall asleep and get restful sleep. When you wake up in the morning, try to get some sunlight on your face for 10 minutes on your eyes without sunscreen, without glasses, because this is going to help you make more hormones at night that help with sleep. Keep your blood sugar stable. Eat protein every 2 to 4 waking hours. If you're going to do really intense type of workouts, try to do those earlier in the day, not at night. Make sure you do things like detoxification once every 3 to 4 months. Make sure you have a spiritual practice in place, such as meditation, journaling, some combination of both to help your body properly respond to those stressors. As far as doing something to fix your hormonal imbalance, I'm sorry I can't advise you on that because I don't know what your hormonal imbalance is, but one of the best tests out there is called a Dutch hormone test, and that's a test you can order on your own. Now, I don't think you'll be able to interpret it on your own. That's kind of the tough thing, but you'll be able to order it on your own. You can order your own thyroid testing. If you do, make sure you don't just look at TSH. You look at your fat burning hormones like free T3, total T3, as well as your thyroid antibodies, which are TPO and thyroid peroxidase. Make sure you check markers of inflammation, particularly C-reactive protein, because that can keep you from losing weight. Check for nutritional deficiencies such as low ferritin and low vitamin D. These can rob your cells of oxygen, and when you do work out, you don't feel you don't feel better, you feel worse. And in some cases, you'll have chronic fatigue, brain fog, depression, even anxiety. So it's important to look at the big picture when you're approaching your health. Hope that answered your question.